Well, this frozen image is that of a 50 years old male with a history of low-grade pain in the right lower abdominal quadrant. And I want to show you that in this frozen image, this longitudinal tubular structure, hypoechoic irregular wall, this one, and this is the wall, this black area measuring approximately 3.7. This is the dimension of the wall. It's irregular, and the other lumen is collapsed, and these are a few echogenic particles seen. Otherwise, now this is a bowel segment in the right lower quadrant, collapsed and with irregular outer wall. Now, if the wall had been more than 5, would have been we may have thought of an aggressive pathology, but this is very much consistent with sonographically. It's very much consistent with an inflammatory nature of this bowel segment. Now, this segment here you are seeing bowel-related mass. On the left side of the image, this is the liver, and in the posterior segment of the liver, this is the diaphragm, and this area, which measures approximately 84 by 83 centimeters, is in fact a healing phase liver abscess. Why I say healing phase liver abscess? Because as you see the posterior wall enhancement, because of which the hemidiaphragm, right hemidiaphragm, is appearing more brighter than normal, whereas the liver is normal. And secondly, see the shape rounded, it's rounded in the, and the another reason why I say it's a healing phase, because he has been on the antibiotics and flagell etc. for 2-3 weeks, and that's why we are seeing echoes. It's not cystic clear, it contains echoes. These are all echoes with a few hypoechoic areas within. So when we see such a cystic area which is filled with thick echoes, is suggestive of healing phase pathology. Now, if one has to drain this abscess, we'll have to use a wide bore needle. This is the importance of informing the referring doctor or surgeon, so that he may know this, that the material within the pathological lesion is thick enough, which needs a wide bore needle if the surgeon wants to aspirate it. So now, this is the middle hepatic vein. Now let's see all this on real time. First of all, let's see the pathology relating to the bowel. Here it is. You see, when I move the probe from the right hypochondrium, everything is okay. But as I come down, this is the lower abdominal segment, and you see the bowel-related mass, the description of which I have given. This is in the longitudinal section, and this is the transverse section, almost giving a target sign. You see, this is the transverse section of the same same lesion. 2.17 centimeters. Now, another thing to see is whether there is any adjacent adenopathy. These are iliac vessels, common iliac vessels and internal iliac vessels. No adenopathy is seen in this region. This area is important. Why? Because we have to rule out if there is any para-aortic adenopathy. No, nothing. This is the portal vein. This one is the portal vein. There you are. The portal vein is normal, patent. this is the portal vein. Okay, now in the posterior segment, if you see, first of all, let me show you that there is a very small amount of fluid seen in the right pleural space that is reactive or sympathetic because of the pathology in the liver. This is a small amount of fluid above the diaphragm, which will not be seen by X-ray studies. Now here comes the here we see subcostal view I'm giving you. Now this is an abscess that this area. This is an abscess. See the posterior wall announcement. When I gave a sweep to the probe, complete sweep to the probe, it does not change its shape. It retains its shape, which is the characteristic of cystic lesion, and it does not show any vascularity with it. So the liver is normal. Here comes the portal vein. The gallbladder is normal. One thing I would like to see, now this is liver abscess, this area. Now one thing that I will see is if there is any splenomegaly. No, the spleen is normal. So this is a case of the day that relates to a related pathology in the right lower quadrant with a liver healing phase liver abscess. Thank you very much.